The Wuhan virus is back and it remains our top focus today as well. In India, the air smells of precaution. After Kerala, the JN.1 variant has now been recorded in Goa. There are at least 15 new cases of this subvariant that we know very little about as of now. States have their guards up, and so do other countries. COVID cases in Malaysia have doubled. Singapore has become a country of great concern. Indonesia has asked those travelling to be as vigilant as they were back in the pandemic era. I have to say, it's Deja Vu December. And I'm bringing you the latest at 9 p.m. IST. India has reported 142 new Wuhan virus cases in the last 24 hours. The active caseload has gone up to 1,970. At least one person has died. The victim was from Karnataka. The new subvariant JN.1 has become the talk of town. The subvariant has now been found in samples collected in Goa. Across India, Wuhan virus cases are steadily rising. In the last 24 hours, new cases were recorded in Kerala, Karnataka, Maharashtra, Puducherry, Gujarat, Tamil Nadu, Madhya Pradesh and Delhi. As for the active cases, Kerala alone accounts for 1,600. So the next obvious question is, how is India reacting to the upsurge? Testing has been scaled up in Uttar Pradesh. Like we told you, Karnataka has asked the elderly and those with underlying comorbidities to mask up immediately. The government of India has advised states to monitor and report cases of any influenza-like illness, any symptoms, any cases of severe acute respiratory illness as well. This new subvariant has come with a fear factor. The world has seen what the Wuhan virus is capable of. India remembers the horrors of the Delta variant. So could JN.1 be as transmissible as deadly? The answer is we don't know yet. The JN.1 was first detected in Luxembourg. In September, the subvariant was found in the US. China reported a case on the 15th of December. The country of particular concern here is Singapore. Why do I say that? Because in Singapore, cases are rapidly rising. Let me show you some statistics from Singapore's Ministry of Health. On the 28th of November, the daily average of COVID-19 infections was a little over 3,000. Cut to present, the number now is 7,730. Cases have doubled. Look at the weekly numbers. That too has almost doubled, from 32,035 to 56,043. That's a big jump. Singapore's Ministry of Health is now updating COVID numbers daily. It is back to the pandemic drill. Because the situation is getting worse. Hospitalization has gone up. Around 349 people are being admitted to the hospital daily. This is in comparison to 224 the week before. Average ICU admissions have gone up from 4 to 9. That's more than double. The statistics are grim and Singapore is pointing the finger at JN.1. Businesses have increased their cleaning frequencies. A second COVID-19 treatment facility has opened at the Singapore Expo. The facility aims to cater to those who do not need intensive hospital care. Let's look at Indonesia now. The country has recorded 2,243 new cases. In Jakarta alone, 200 cases are being recorded daily. The JN.1 variant has been reported in Jakarta, Batam city and the Riau Island province. The country's Vice President, Maruf Amin, said on Monday that mask wearing has been advised in some locations. Reports say thermal scanners have come back at some border checkpoints. This includes Jakarta's international airport and the Batam ferry terminal. Let's talk about Malaysia now. Cases have doubled in the week ending December 2nd. The country's transport minister has advised people to mask up on public transport. The country's Kelantan Islamic Religious and Malay Customs Council too has advised people to go back to wearing face masks when at the mosque. The Yang di Pertuan Agong, or unofficially the King of Malaysia, has advised people to avoid 3 C's: crowded places, confined spaces and close conversation. That's the situation in Asia as of now. The Wuhan virus is making its way back into people's homes. Elsewhere too, it's not too different. Take the case of Germany, the United Kingdom, the United States. They are all reporting a steady rise in Wuhan virus cases. So, what should you do? How can you keep yourself safe as well as your loved ones safe? It is, after all, the holiday season. Airports and railway stations will be crowded. Tourist spots will be buzzing. Hotels and restaurants will be fully booked. But what's needed right now is awareness. People need to understand that celebration can wait. If you are feeling under the weather, stay home. If you have symptoms like a cough, a headache, sore throat, or difficulty breathing, then call your doctor immediately. Prioritize precaution. Mask up. Bring back sanitizing, hand washing frequently. And if you are traveling, be extra careful. Now, here's what authorities should do. 1. Focus on crowd management. Ensure spaces are well ventilated. This will minimize the spread of the new variant. 2. Prepare hospitals. Ensure states have adequate beds, oxygen cylinders. India has come a long way since Delta. India's healthcare infrastructure has been ramped up. Today, there are critical care hospital blocks in every district. Lab networks have been strengthened. There are dedicated COVID care centers. India's medical staff has been trained to handle the Wuhan virus. Today, 95% of the Indian population has received at least 2 doses of the Wuhan virus vaccine. But will the vaccine be effective against this new subvariant? We don't know. But what we do know is that winter months and pollution compromise our immunity as is, year on year. So what we need is to stay alert, to stay vigilant, and above all, stay calm and do not panic. WION World is now available in your country. Download the app now and get all the news updates on the move.